Lindsey, you did such a good job with your presentation today on setting expectations prior to surgery and even after surgery.
Oh, thanks.
Tell me kind of your big takeaways from the presentation today.
I think something that, we all strive to do is to educate our patients to the best of our ability so that they can better understand things in order to have better outcomes. And I think the key takeaway here is that no patient is the same. And so being able to change and adjust to what their expectations are leads to better outcomes.
Yeah, absolutely. I think about all the patients I've treated over the years, and so many come in with different expectations, different educational background.
Mm-hmm.
Health literacy is a term that we throw out there.
Mm-hmm.
Health literacy meaning they just don't, maybe they understand the healthcare system, maybe they don't. And in the medical system, we use all this jargon that just is really confusing for people, and they may not understand. What are some skills that you use in the clinic to really help people understand and bring it to their level and customize it to them?
I think something that I try to do is just educate them in a way that, making sure that I'm using resources that they are familiar with, or some people prefer to see a copy of what I'm saying so that they can read through it, visual and also hearing it. So, I think that guiding it is variable depending on what they want to take away from it. Also, I think reading back having them kind of say back what I've taught them is always beneficial as well, so that we understand that we're both hearing the same thing, because it often gets lost in translation.
Yeah, I love what you said about the teach back method.
Yeah.
One of the things that we like to do in the medical system is check understanding at the end of the visit. Based on today's visit, what do you understand about what's going to happen with the surgery and what's going to happen after the surgery? Because a lot of people, they might understand the surgery, but then they don't understand there's going to be a lot of swelling, there's going to be a lot of pain after the surgery,
Mm-hmm.
and that's really where the work begins. That's where you'll start physical therapy and go through this process, and your physical therapist will help walk you through this journey as well.
I love that. Yeah, and I think too, finding out what their goals are. So, for some people it might be that they want to go hike a mountain down the road, or other people it's simply just getting around their house safely without falling. And so realizing what their goals are and tailoring that education to what their needs are is really important.
I love that. And I love when providers will use analogies that are customized to the patient. So say there's a patient that's a mechanic, maybe using some mechanic jargon. Maybe you don't know that jargon extremely well, but you could say like a car.
Mm-hmm.
This is a diagnostic injection that we're going to use. Sometimes in the car world as a mechanic, you diagnose if it's a problem with the starter or a problem with the motor. And we're doing the same thing with this injection. But using those analogies to really help connect to the customization of the patient, I feel like has been really beneficial. I
agree. I think my main thing I'd want to tell our patients is if you're not understanding, please ask questions so that we can better treat you.
Yeah, absolutely. I think the curiosity piece that you're talking about, asking questions. Yeah. Because sometimes we have 10 pages of information we need to explain, or at least we think we need to.
Mm-hmm.
But you asking questions really helps us get to the point of, how do we customize this to you? What questions do you have? And being curious as a patient is so helpful, because then we can really tailor it to you.
Yeah, I love that.